So we are doing an assessment comparison on VB-MAPP and PEAK by Carolyn Gleave, Christina Gunn, Sydney Jordan, Rachel Jeter, and Hope Gassett. First, Christina is going to talk about the PEAK assessment.
Awesome, thank you. So PEAK stands for Promoting the Emergence of Advanced Knowledge, and it was created in 2008 by Mark Dixon. The assessment the age range for the assessment are typically children ages 2 to 17 years old, and it goes through 184 skills arranged in order from least to most difficult. The skills are broken up into 4 domains covering skills including maintaining eye contact, gross and fine motor movement, object permanence, making requests, naming items, and even more complex verbal behaviors. It can be measured with an assessor or caregiver familiar with the learner, and they can directly or indirectly conduct the assessment. Each skill is assessed in 10 trial blocks. If the participant demonstrates 80% or higher accuracy in a trial block, it is considered a mastered skill. These mastered skills are then added together for a total score ranging from 0 to 184. This assessment has a pretty high internal validity, which means the results of the assessment can be trusted. The PEAK assessment provides explicit instruction for practitioners to follow, and the training should be conducted by an experienced PEAK practitioner to increase the reliability of the assessment results. The assessment is very useful in determining intervention. The skills tested in the assessment correspond directly to a guided training curriculum, which can be used to select programs for each client's instruction. There are 184 items on the assessment and training curriculum, each getting progressively more complex. The assessment also breaks up the skills that should be acquired by each age, which helps to determine what skills certain age clients should have in their repertoire.
Up next, we have Caroline, who is going to discuss the VB-MAPP assessment.
VB-MAPP stands for Verbal Behavior Milestones Assessment and Placement Program, and it measures verbal behavior, guides the individualized instruction needed to address any deficits, and evaluates the individual's progress throughout treatment. The VB-MAPP is divided into 3 developmental levels, 0 to 18 months, 18 to 30 months, and 30 to 48 months. It can be used with individuals of varying ages as long as they have deficits in the verbal behavior you would see in typically developing 4-year-olds. The assessment has 5 components and measures 170 different milestones from beginner to advanced. Some of the skills assessed are requesting, naming, responding, matching, motor imitation, vocal imitation, independent play, and classroom routines. Each level expands on the skill in the previous one and become more complex. There are 4 assessment methods: direct training, observation, a combination of both, and timed observation. To start, a pre-assessment interview is conducted with caregivers to determine which level to start with. Each level of the assessment has 5 items that grow increasingly more complex. The materials needed are included in the instructions. Participants are then scored a 0 for no mastery, a 0.5 for partial mastery, and a 1 for mastery for each item. The assessment is discontinued for a given level when the participant scores a 0 for 3 consecutive items. Although there haven't been any formal studies on the internal validities of the VB-MAPP, there is external validity between the VB-MAPP and PEAK because there is a strong relationship between the results of the 2 assessments. In order to achieve reliability, assessors should be familiar with Skinner's analysis of verbal behavior and basic behavior analysis. The milestones of typically developing 4-year-olds are assessed to determine the client's current skills. The results of the assessment can help guide program goals and suggest next steps. There are 3 skill levels broken up by age, so you can determine at what age the client is currently functioning.
So up next, we have Rachel, who is going to discuss our hypothetical client and give y'all some background.
Our hypothetical client is a little girl named Ashley. Ashley is 3 years old and she has autism. Ashley lives at home with her mother and her father. Ashley has 3 older brothers that also live at home. When she was 2 years old, she was referred to a pediatrician by their daycare teacher as she showed delays in language, social awareness, and behavioral concerns. Ashley then received a formal diagnosis of autism spectrum disorder at the age of 3 years 1 month by a local autism diagnostic center in the area. After receiving the formal diagnosis of autism, Ashley's pediatrician referred her mother to seek ABA therapy. Ashley is able to communicate verbally with a repertoire of about 5 to 10 words. Her mother reports that she will only communicate when she wants something. She will ask for milk or cookie when the refrigerator door is open and in her eyesight. Ashley's mother also notes that the family has difficulty understanding Ashley as she struggles to enunciate her words. They have recently started teaching Ashley some sign language using the baby signing time videos. Ashley will throw herself on the ground and kick and scream when she is unable to communicate or is denied something that she wants. She has also bit her peers at daycare to access their toys. Ashley's teacher reports that she shows little to no interest in playing with her classmates. She often sits by herself during free choice time and manipulates toys in a way to engage in self-stimulatory behaviors, such as taking the trucks and turning them upside down to flip the wheels. Ashley will tolerate her teacher sitting with her and prompting her to use the toy in the way it is intended. However, as soon as the teacher leaves, Ashley will resume the use of the toy incorrectly.
Up next, we have Hope, who is going to discuss which assessment we feel is a better fit for our client.
After comparing the 2 assessments available for Ashley and considering her specific needs, we have chosen to use PEAK initial assessment. Dixon and Associates state that PEAK provides a more robust measure of language repertoire and may service more individuals with autism. Since Ashley has severe language delays, we believe PEAK will strengthen and build her language repertoire. PEAK provides a guided training curriculum that we can use to select programs for instruction based on the results of the assessment. PEAK also tells us what skills should be acquired by what age, so we can work to close the gap in those areas of skill deficits.
Thank y'all for watching our presentation on PEAK and VB-MAPP.